Osteoarthritis doesn't have to be crippling, and there are some new treatments to help ease pain. Dr. Charles Stewart of Boca Raton Community Hospital joins us this afternoon to answer your questions. Nice to see you again. Thank you for your time.
Good morning, Roseanne.
What is osteoarthritis?
Osteoarthritis is a wearing away of the cushion or cartilage on the end of the joints. It can happen any joint in your body, from your little finger to your hip, and it can be a crippling disease if left untreated.
Well, who's at risk of getting it?
Everyone's at risk for getting it, but there are certain risk factors. Obesity is the #1 risk factor. Heredity, it does run in families. Sports, those people who played basketball, soccer, cutting sports tend to have more arthritis than runners. Interestingly enough, runners do not have any more arthritis than the general population. But it's those cutting sports that cause micro trauma to the knee, and then consequently can lead to later arthritis.
So it's not something you get just wear and tear of the body because you're aging. It's something that anybody can develop.
Anybody can develop it, but there are increased numbers in certain groups.
What are some of the symptoms?
Rubor, color, and dolor, Latin for red, hot, and tender. The legs, the joints will swell, they become red, become painful.
Okay, if you get it, can you still exercise?
Absolutely.
If you have it.
My mantra is motion is lotion. We want people to exercise. It sounds counterintuitive, but most people who come in to see me say, I can't exercise because I hurt. And I turn that around and say, we want you to exercise. Exercise in the appropriate fashion is the best treatment for arthritis.
That's I think the key thing there is, though, in the right way, because
the right way, yes.
People will say, I can't do anything, it hurts, but there are things you can do, such as swimming.
Absolutely.
Tell us some of those exercises.
Well, I think swimming is one of the best exercises. It is difficult, especially for women in their hair. They don't want to get in the pool because they have to dry their hair. But you can do exercises in the pool without getting your hair wet. There's an aqua vest that people can wear and walk in the deep end with their feet never touching the ground. You can simply walk in the water. You don't have to swim, and that can give you the exercise that you need.
There are some of those tools, even the weights for the legs and things in the pool that you can use, but many tools that when you get in the water you don't have to sink necessarily.
Exactly. Especially here in South Florida, where most people have a pool. It's a great tool to use to help those joints do better.
How do you treat it, osteoarthritis?
Well, the treatment of arthritis depends upon the extent of the disease. Anything from modifying your activity. If you're a runner and it hurts to run, well, maybe you'll ride a bike now or walk. If your joints are deformed and they're severely painful, then joint replacements is one of the things that we do. I've had both hips replaced, so I've been through the whole route of depression that comes with the lack of exercise. I couldn't run like I used to, and I finally decided to have my hips replaced and had those done successfully this year.
And what kind of patient were you, Dr. Stewart?
I think I was a very good patient. I was back to work in a week.
Oh, you were?
So I didn't take much time off. I think the key is just to get back into your routine as soon as you can.
Very quickly, does diet help?
Absolutely. The #1 factor for risk factors is obesity. For every pound we have, we put 3 to 4 times that across our joints as we walk. Keeping your weight down is the #1 thing I recommend people do.
So diet, healthy diet works.
Absolutely.
Always good to see you, Dr. Stewart. Thank you for the information. Boca Raton Community Hospital sponsors our expert and also underwrites our Ask the Doctor segment. We're back.